Tells you where it is. It gives you a phone number.
Yvonne Wright can see her mother's up-to-the-minute medical records anytime, any place.
The appointments and the
tests and reports. Anything and everything that you do, even the drop-in with the doctor.
She's looking at an online patient portal. It was set up by the University Health Network in Toronto, which is coordinating her mother's cancer care. Appointments aside, the portal allows patients and authorized users to access their medical history, including blood tests, x-rays, scans, and medications. Wright says the family feels engaged.
We could watch her blood pressure go up and down. Is there an issue? So we were able to ask the doctor, this is happening or this is happening, what does this mean?
Harm is being done because patients don't have access to the records.
Dr. Iris Gorfinkel is pushing transparency for all. In a recent commentary published in the Canadian Medical Association Journal, she insisted Canadians should have easy access to their medical records.
It could be life-saving in the emergency room. And unfortunately, most patients, they have no idea what medications they're on or what those medications are for.
Right now, a patchwork of patient portals have been created by individual doctors and some hospitals. Nova Scotia and Alberta have been working on integrated portals that could be shared by all potential healthcare providers, but no province has figured it out just yet. Patient privacy is the major issue, but there are others.
Some of the language sometimes is, this overweight, divorce, middle-aged, and none of that is particularly untrue, but there's a dehumanizing element about it as well.
This bioethicist says when patients start reading their medical records, they could be in for an eyeful of unfamiliar terminology.
When in fact patients have access to their very charts, it's going to be tough. It's going to be very confusing.
Something Wright experienced firsthand. The results from one of her mother's scans appeared to say she had no cancer. The family celebrated and later found out NO stood for the word number. Wright also dreads receiving bad news.
I think the language on the reports need to be addressed because it can scare people. I think it's great because it empowers you as a patient and it helps you take control.
While complicated, Wright hopes every Canadian, including herself, will have online access to their own medical records sooner rather than later. Christine Birak, CBC News, Richmond Hill, Ontario.
Okay, so how soon is soon? We'll take Alberta again. Some parts are expected to get connected in late 2019, but even that is by no means a sure bet. The province has spent about a decade and millions of dollars trying to set its system up. It was supposed to be fully online last year, but the launch was delayed because it didn't work correctly on smartphones. So stay tuned.